All right, let's bring you back to COVID-19 now. Cautious optimism. That maybe is the best way to describe the mayor's comments yesterday, as it may be time to start thinking about what a gradual reopening of this city may look like. But yeah, we have still a long way to go. Mayor John Tory now joining us for his weekly check-in. Good morning to you, Mayor Tory.
Good morning. And you articulated that very well. I think you could have put a couple of more qualifiers on it, because I'm not trying to be the bad news bearer, but,
Sure.
think about it. We were sort of really happy in the summer when we were reporting, I think, on a few days in Toronto, like 80 new cases of COVID-19 a day. Now we're suddenly, all happy-faced because we've reported a number that's, say, 500 yesterday, I think 502 or something. So, look, things are going in the right direction compared to where they were, but there are still increases in hospitalization taking place. The hospital system is still under great stress, and we have things like the variant to worry about. So I'm not trying to be the bad news bearer, except to say, yes, of course, we should be beginning to plan for some kind of a staged, appropriate, healthy, safe reopening of things, because the day is going to come. But it's no reason for people to let up on what has been, I think, pretty encouraging behavior in terms of staying home. And we can see it from the phone data and from the traffic data that people are doing it. But they've got to keep doing it for a while yet, so that we will have a good reason to reopen. I'm just saying we're going to be doing the planning.
The planning. Okay, so when it comes to that planning and the sort of staged approach, as you mentioned, what could those stages look like? Who is the priority to reopen, and what could that look like?
Well, it's not up to me to decide that alone. It's up to the health people, first and foremost, because what you want to do is make sure you don't provoke a third or fourth wave. And it's up to us working with the province. I mean, I think ideally the province sets, region-wide or province-wide rules for this kind of thing. But I think if people can think back to the experience of last time, where different kinds of things reopened at different points in time when things were going well, I think it'll be a similar kind of experience. And obviously, I'm guessing that the province, and I would certainly agree with this, will be placing a top priority on the schools and making sure that you can get kids back to school as quickly as possible in a safe manner. And then from there, it'll go through different kinds of businesses. And I think last time, people will recall that the opening of the business and the timing of that had some direct correlation to the degree to which people are close at hand, in close quarters, in a place where the virus could be spread again, which we're trying to avoid at all costs. So I think it won't be that much different than before, but I'm presuming that we've got to embark on that discussion and do it carefully and do it sensitively. But the number one sensitivity, of course, being public health and making sure we don't slide backwards again.
Yeah, I think no one wants that. So we'll be watching those modeling numbers again coming out this afternoon. But let's look at here in Toronto. So some encouraging news, at least with the long-term care homes, in that these vaccines are slowly starting to get rolled out again, at least those second doses. Is there an update on the Metro Toronto Convention site and when that site may reopen? Is it just waiting on Pfizer for that shipment?
Exactly. There's no point in opening a clinic, which actually there was a small problem with the information management system in the first couple of days, but otherwise it worked perfectly. And we've already sort of had a report on 2 days of operation on lessons that were learned to fix things like the information management system and so on. But the only problem that's keeping it closed at the moment is a lack of supply. And so the province will tell us when the supply issues are addressed. And it will be the case, perhaps, that the supply, when it resumes, will go in a direction other than that particular clinic first, maybe to more long-term care, retirement homes, or something like that. But we're just ready to go. And I should say to people that so they know what the city's been doing under the great leadership of Chief Pegg, we have an entire network of clinics that are not scheduled to open for a while yet, even on the sort of the originally drafted up schedule. But we have that network ready to go. The places have been selected. The staff are by and large hired to man them, so that we're ready to go when the province says it's time, and they set the rules on this kind of thing. And of course, the federal government supplies the vaccine. So we're ready to do our part to make sure people get these injections as quickly as possible likely in the sort of very late winter, spring months. Our large numbers will be starting to get vaccinated.
One thing that I just want to mention, it's tough to think about this in the winter, but we look ahead to the summer and the expansion of, say, that Cafe TO and the Active TO programs. Where does all of that stand? I know those conversations, at least, are definitely happening now as we look ahead.
Well, City Council is going to approve. I'm optimistic. The Executive Committee approved yesterday the Cafe TO program resuming, with improvements where people can build decks and platforms and so on, and with a much longer season that's contemplated, because last year we didn't even come up with the program until into June, when we were right in the middle of the pandemic. And so the applications will be open in about a week or so, as soon as City Council approves this, and then people can make application, can make the arrangements with the city. And the idea is to have these patios open in time for the May 2-4 weekend. people may say, why so late? Well, we have to clean up the streets from the winter and remove all the leaves and stuff from the catch basins. Otherwise, we'd have flooding in the summer. And so we have to do that work, and we'll get it done as soon as possible. In fact, I moved a motion yesterday to have the city look at trying to accelerate that timetable a bit so every one of those patios could be open for May 24 for sure. And that's going to be the objective we'll be aiming towards. And our staff did a great job. We had 800 restaurants in the BIAs and another 100 and some odd around other parts of the city last year. So almost 1,000 restaurants took part in this, and we'd like even more to take part this coming year.
Well, we know they're definitely going to need the help coming the weather being nice, spring and summer. Mayor Tory,
Right.
we've run out of time. As always, we appreciate you taking the time with us weekly. Thank you.
Mel. Thank you. Okay, bye-bye.
All right, 7:10. That's what we're sitting at right now. Devo Brown, what's going on?